What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. Today, we're going to be going through more practice problems, just kind of getting ready for your quiz 2. So we're going through brachial plexus, some arteries, some different muscles and nerves, and just kind of working through some clinical cases together, okay? So go ahead and give this a try. Read through it, pause it, and then unpause, we'll talk about it together. Cool? All right. So a 38-year-old patient presents with the inability to supinate the forearm. Which of the following is most likely damaged? So when we're talking about supination of the forearm, so here is a supinated forearm. Here would be pronated, right? Here's our pronated forearm. And if I want to supinate, it would be this section just like that, right? So this would be supination of the forearm. Now we have to think of which muscles can help us supinate our forearm. Well, we have the supinator, right? We have our supinator that kind of originates on this side and helps us supinate our forearm in such a way like that. And then we also have another supinator, right? So if we have actually a flexed forearm like this, we can actually supinate our forearm using our biceps brachii, right? So supinating the forearm, if our forearm is flexed, we can actually use our biceps brachii, and it's going to help us supinate that forearm. So with that in mind, now we have to think of different types of innervation to those muscles that helps us do those functions. So the supinator actually is a posterior compartment muscle. So supinator, if it's a posterior compartment, we know that the radial nerve innervates the posterior compartment of the arm and the forearm. So supinator innervated by my radial nerve. So immediately, when we're thinking of supinator, we can go through and we can already cross off some things, right? B doesn't have the radial nerve. A doesn't have our radial nerve. And then E also doesn't have our radial nerve. But D and C both have radial nerve. Now we have to think of axillary versus the musculocutaneous. Well, our musculocutaneous innervates the anterior compartment of our arm. And the axillary nerve goes to the teres minor and also goes to the deltoid. But those actions aren't going to help us do any type of supination of the forearm, right? So this is acting mainly on the arm, our teres minor and our deltoid muscle. So here we have the radial nerve, and we also have our musculocutaneous, right? Because this goes to our anterior compartment of our arm. So that would be like our brachialis muscle, both heads of the biceps brachii. So in this case, the biceps brachii not only help with flexion of a supinated forearm, right? But they also help with supination of a flexed forearm, right? So we can actually do supination of a flexed forearm in addition to doing flexion of a supinated forearm, right? Because we know that if we pronate our forearms and we want to flex the arm, that the brachialis will do that function, right? If we want to flex our at the elbow joint, then we're going to actually use the brachialis muscle. But here we're more concerned with the actions of supination, so these nerves are going to help us with those supinations. So D is our best answer choice, all right? Thanks for tuning in, guys. We'll see you next time.